Okay, so we started the recording. So today we have about 5 stations. We will focus today about one aspect of the OSCE exam, which is the multi concern stations. You may encounter some stations that has more than one concern. Okay, it's very important to get to know to get yourself used to how to solve one or two or even three concerns at any named station you may have. Okay, so today we have, like we always did, we will start by one candidate. If he didn't able to sorry, he wasn't able to completely solve the station, we can proceed to another candidate as maximum 2 candidates per station. Okay, so now we'll start with station number 1. I will share you the screen right away. There you go. Okay, so you can see my screen now. Where is the recordings? Yes. Just allow me a few seconds, my friend. I have to regulate this thing. Okay. So, no problem. Okay. So, who we have as a first candidate? Who would like to go first? We have two. We have Tariq. Tariq as usual. Okay, so I'm not aware who raised his hand first, but as usual, we can go with Tariq, and Mamdouhi will be the next one. Okay?
Yeah, sure.
السلام عليكم.
ازيك يا باشا؟
ازيك يا بيه؟
I would like to just one moment. أنا عايز بس أفتح ال reference. بص, I will send you the reference in the WhatsApp group. Is that okay?
Okay. Yeah, definitely.
Yeah, you can open it in your own laptop if you want.
Yeah, that will be better actually.
Yes.
So
Yes.
give me only a couple of seconds. I will.
Yes, no problem.
Is it something from CTC or CTMA so I can?
No, my friend. No, my friend. It's from natural medicine.
Okay.
I can open it here on the screen if you would like, but I thought it would be easier.
No. It's almost. I'm actually. I open WhatsApp on my laptop.
Okay. So, anyways, I will open it here as well.
Okay, sound good.
For the other candidates, yes. What is it? What's name? It's medical frontage. There you go. Here you go. Okay.
Okay, yeah, I think we can start. Yeah.
Okay. Need a timekeeper. Who's gonna keep our time? Can you do it, Gazuli, or?
Keeping time? No. We can rely on our beautiful Banafsha. She's the one she used to do this before, if she doesn't mind.
She doesn't mind.
I can do it, doctor, if you want.
Who are you, my friend? Fight.
Yes.
Fight. Okay,
Debrief.
keep the timing, my friend. And when it comes to the last 2 minutes, give us a notice. Okay.
Sure.
Thanks. Bye.
Just 1 moment. So Fayed, we will allow about 30 seconds first. Okay, for the
Okay.
candidate to read the material, and then we will start. Okay.
Okay. Okay.
طارق استنى ما تبداش دلوقتي. Okay.
Okay.
One moment.
Take your time.
Okay, so start counting the 30 seconds, Fayed.
Okay.
And I'll let you know when it's finished, right?
Yeah.
Okay. Start.
For this station, you have over-the-counter medication on the table, and you have one reference.
Thanks, Scott.
Time.
Hi, I want to talk to the pharmacist.
Hello, hi. I'm Tarek, the pharmacist. How can I help you?
Yes, my name is Nicole. I have a file here in your pharmacy. I'm seeking your advice about like a sleep aid medication or something that you can recommend me to help me better sleep. It's been about.
Mhm. Definitely, I'll be glad to help. Let's have a seat in our counseling room where we can discuss further.
Thank you.
So, Nicole, you were talking about you have a sleeping problem?
Yes, it's been about 4 or 5 days that I'm not sleeping so well. So I know the reason. I'm a little bit stressed at work. It's been about 1 month that I'm under huge pressure. So I think this is the main reason for that. So I'm looking forward to have a medication that can help me these days till I see my doctor in 2 weeks.
Okay, that's yeah, it's like it's bothersome. So I will do my best to help you. So I need to ask you a couple of questions to give you my best recommendation. Is it okay with you?
Yeah, definitely. Yeah.
So you are telling me you have a file here. I could see your name is Nicole Saba, right?
Correct.
And you have 37 years old. And from your file, I could see you take Elise, a birth control, right?
Yes, correct.
Okay. Okay. And oxybutynin, 5 milligram, 3 times daily.
Yes.
For which reason you are taking oxybutynin?
It's like for stress urination or something like that. A problem in my bladder.
And is it working well, or you still have
Yes,
that?
yes, it's okay. Yes, yes.
Okay. Also, I could see you are taking citalopram, 10 milligram, 1 tablet daily. For which reason you are taking citalopram?
It's for an anxiety.
An anxiety.
Yes.
And how it's working so far?
I don't know. I'm a little bit stressed now. So I don't know. Should I increase the dose? Should I continue like that? Can you add another medication? I don't know.
Okay, and you started citalopram like only 2 weeks ago.
No, I started it since 1 year ago, and it used to be effective.
Okay, it used to be effective, but then you like since when did you notice that it's not effective anymore?
As I told you, I got some huge pressure at my work.
Oh,
Since about,
okay.
yes, maybe 3 or 4 weeks ago. So
I could see. So Nicole, yeah, you for the sleeping problem. So other than can I know? Okay, this is gravel.
yes, you have any questions?
I think it's oh my god.
Take your time, no problem.
Yeah. Give me to collect my thoughts. Okay, just
Yeah,
give me 1 minute. Okay.
yeah. We have 5 medications on the table. Here you have 3, and you have these 2, and you have 1 reference.
Okay, I got it. One valerian gravel. Okay. Regarding your sleeping problem, have you talked with your doctor about it?
I will see him. See him in 2 weeks.
Is it 2 weeks? Did you try anything over the counter?
No, not yet. That's why I'm here.
Okay. Did you have any chronic condition, any medical condition other than that one is the one you told me?
No,
Anxiety and okay.
no, that's it. That's all.
Do you smoke?
Do I smoke?
Yeah.
Yes, I started smoking 2 weeks ago. Heavily since 4 weeks, I think.
Oh.
Yes. I used to smoke about 1 or 2 cigarettes per day, but 4 weeks ago I started to smoke a pack a day.
Okay, I get you. I get you. So I will get back to the smoking issue later. What about drinking alcohol? Do you drink alcohol?
No, no.
Okay. What about your sleeping habits? Do you usually watch TV before sleeping? Do you exercise at night?
I don't have time to. No.
You don't have to, so you don't exercise.
2 minutes.
How about caffeinated beverage? Do you drink caffeinated beverages?
Yes, all the day.
All the day. Okay. Thank you so much for this. From what you have told me, actually, for your sleeping issue, as you told me, the stress that you are facing in work that could contribute in your sleeping problem, but also I could see some habits if it could be improved that will really help you in sleeping. For example, smoking. Okay, that will disturb your sleeping pattern. So we have in this pharmacy a program to stop smoking.
I cannot stop it now.
You can't stop it now.
No,
So
no.
in case if you think about it, really you can call us and we can book an appointment where I can discuss
Sure.
with you further the best way to stop smoking. Okay.
Yeah. I will let you know.
And regarding also caffeine, it's really will because the caffeine was a stimulant that will disturb your sleep. So I will
Yes, I
help.
understand that. I understand that more caffeinated beverages will not let me sleep. But now I'm seeking a medication because I cannot stop neither the caffeine nor the smoking. Okay, so I would like to have a medication. If you have any,
Can you go like for the medication other than Valerian or the gravel? What's the other 3? Sleep is diphenhydramine and melatonin
Okay. Should I wait to see my doctor in 2 weeks?
I could see this Telegram could contribute in your sleeping problem, but you have been on this Telegram for some time, and you take it at the morning or at the bedtime. Telegram.
Time.
Okay, sorry. Yeah.
خلص بقى أقول أي حاجة تانية.
ما أنا كنت
You'll see for nitrogen
What do you
point,
like?
again, very low rates of E. coli resistance, only at
Guys,
3%. Fosfomycin also has very low rates of resistance, 1%, right? So it's quite good. When we look at Septra,
Who is it, my friend? I'm trying
Rasha
to.
was listening to another stations. Anyways, continue, Muhammad.
So I think we could. Well, I don't know. Really, I don't know. I will pass. Really.
Let's have another.
It's not
let's
your
have
habit.
another candidate.
Sorry.
Let's
Let's have another candidate.
Yeah.
Good job, Tariq. It's not an easy one, okay? يلا ممدوح. Yes, Mustafa, we have Mamdouh first.
I lowered my hand.
اخص على الرجالة. Okay. So Mustafa.
Hello, good morning.
Raising your hand. صباح الفل.
صباح الفل.
Okay, so let's start right away. I think you're aware about that station.
Yeah,
Okay.
you can start.
So, Fahid, can we start timing?
Yes.
Yeah. Can I talk to the pharmacist?
Hi, my name is Mustafa. I'm the pharmacist. How can I help you today?
Yes, Mustafa. My name is Nicole. I have a file here in the pharmacy. Yeah,
Mhm.
yes. I would like to have a medication or any tips you can give me to help me sleep. It help me sleep. It's been about 4 or 5 days that I'm not sleeping. I sleep only about 2 or 3 hours per night.
Mhm.
And I think I'm under tremendous stress at my work. So I believe this could be the apparent reason for the moment.
I'm sorry to hear. Yeah. Continue, sir. Continue.
No,
Okay, so
no
not
problem.
more. I'm really sorry to hear that from you, that you are passing this stressful period. I will do my best to help you get out of this. So Nicole Saba, I have here your profile. It's your age is 37 years old. Am I right?
Yes, correct.
Okay, so let's go to the private counseling area in order to collect some information from you and give you the best recommendation. And all our conversation will be kept confidential.
Thank you.
Can you tell me more about your symptoms, about your symptoms and all what you feel now?
As I said, it's been about 4 days or 5, I believe. Yes, I sleep only 2 or 3 hours per night. And that's it. This is the symptoms I have.
Okay, and did you try anything?
No, not yet.
Okay, did you call your doctor or
yes,
to let him know?
I'll see him in 2 weeks.
2 weeks. Okay, for that reason, am I right?
Yes.
Okay, so let me go further to your profile just to update. I don't know. Do you have any kind of allergy?
No, I'm not allergic to anything.
Okay, and I can see here that you take medication. Here I can see Alice 21. For what reason do you take this medication?
A contraception.
Okay, and you're taking it regularly?
Yes.
And is there any side effect you feel with this medication?
No, it's fine.
Okay, and also I can see oxybutynin 5 milligram 3 times daily.
Yes.
Are you taking it as prescribed?
Yes, 3 times daily. Yes, it's for my bladder troubles.
Okay, and since when you start this medication?
All of them since one and 1.5 years, I think.
Okay, and since 1 year there was no problem with your medication at all?
Yes, it's fine.
No side effects? Okay.
No.
For the citalopram 10 milligram, this is for what reason?
For anxiety.
Anxiety, okay. Do you have any other medical condition?
No.
Do you take any over-the-counter medication?
No.
Okay, I would like to ask about your lifestyle, if you don't mind. That will help me to get the full picture about you.
Sure.
Do you drink any caffeinated beverage?
Yes, I drink.
How much?
3 or 4 per day.
Okay, and is it during the whole day? Did you drink at night before bed?
No, usually while I'm at work.
Okay, and what about your alcohol consumption? Do you drink alcohol?
I don't drink. No, I don't drink.
Do you smoke?
Yes.
How many cigarettes per day?
Recently, I start to smoke about a pack a day. I used to smoke 2 or 3 cigarettes per day, but since 4 weeks, I start to smoke a pack.
Yeah, I'm sorry to hear that. I know that is very stressful and you need something that will help you.
Yeah.
But smoking, smoking is not something that will help you to get out of your stress. So I don't know if you are. Do you think about stop smoking?
Not for the moment.
No, not for the moment. Okay, so whenever you feel that you need to stop smoking, you can call us in the pharmacy, and we will be very happy to help you to get out of this. We have different programs for this. Okay, and what about your diet? How could you describe it?
It's fine.
And do you have time to exercise?
No, at all.
At all. Okay. So let me check my reference just a few minutes, and I will come back to answer your question, okay?
Take your time.
Thank you.
2 minutes.
Okay. Okay, Nicole. So after checking my reference here, what I could suggest you right now,
Yes.
a melatonin product. This will help you to get out of, to help you to get some sleep. Okay.
Which one?
The
Which-
melatonin.
Yes, which one? Which
Five-
concentration you will give?
5 milligram. 5 milligram. That you will take one tablet before going to bed, like at least 30 minutes before going to bed. This will help you to get
I
to
believe
go
it's
to sleep.
a little bit. Yes, it's weak. 5 milligrams. Can I take two? 2 tablets?
No, we have to start with 5 milligram. And actually, I would like to tell you that this medication might have some interaction with your contraceptive pill and the contraceptive pill being increase the melatonin concentration in your blood. So you don't need to take two. This will do the effect already. Since you are going to your doctor for these 2 weeks, I want to give you something that will symptomatic relief that to help you to get out of this during this period. So that's why I get this one. I don't want to give you other medication like Gravel or what sleep ease, anything like Esquil. All of this medication may interact with your medication of oxybutynin 5 milligram and
Already?
may
Okay.
yeah. So that's why we are like forced to go to the melatonin for the right now. Meanwhile, I would like to give you some self-care tips that will help you to get sleep, help you to get out of your stress. Try to get some courses for yoga, meditation, all of this breathing techniques. This will help you to get out of this stress. Everybody has stress in his life, so this is normal and will go away after time. But with this exercise, it will help you so much. Meanwhile, when you go to bed, try to sleep in a dark room with no any
Yes, continue. You can continue.
Yes, try to sleep in a dark room. Take a bath before going to warm bath before going to sleep. Try to not use any electronics before going to sleep too.
Okay, thank you.
This is okay. And
yeah. That's it. You
that's
finished?
it. Just one point. If you didn't feel anything if you didn't feel that there is any improvement after 3 days of taking this medication, you have or after 7 days taking this medication, at least you should go to the doctor right away. Do not wait till after 2 weeks. And I will call you after 3 days just to see how the medication is going with you.
ماشي الله ينور يا عم قفلت قفله حلوه انت.
Check. Nice.
Nice, good.
Thank you.
Okay, it's very good. Actually, this station is not an easy one. You did the right choice, by the way. You chose the right medication, melatonin 5 milligram. This is the right one that you should give. Why? Because as you say, there is a possible interaction between melatonin and contraception. So we should start at low dose, melatonin at low dose. Okay, we cannot give this one because it says here 3 times melatonin, and we don't know what's the strength inside. Okay, so this is very important point that you mentioned. And here sleep is we cannot give for the same reason you mentioned. Okay, why? Because why exactly we cannot give that?
This will potentiate the anticholinergic side effects for the oxybutynin.
Exactly. Yes, and here, yes, no need for those. Valerian, there is very, very weak evidence for it. Okay, and that's it. Okay, actually, this station has 3 concerns. يا عم مصطفى.
Okay.
Yes, we have 3 concerns here. We should take 3 actions. Mustafa already did one. Okay, what about the other 2? Any clues? Yes.
I think that melatonin is 1A2 substance, and because smoking is 1A2 inducing, it's an interaction between smoking and melatonin. Could you explain about that? Thank you.
Yes, it's not usually. Yes, it could happen, but it's not. It's not a big deal.
I think the second issue that you talk about, Muhammad, is an anxiety.
My friend,
So it's smoking and anxiety.
Can we make a comment?
Yeah, yes, who is it?
Sahar.
Yes, Sahar, go ahead.
I think she's increased the smoking, and the smoking is induced the metabolism of citalopram, and that makes citalopram is not working now because it was working with her last, and under stress as well, that decreased the efficacy. That's what I thought about it. So I don't know if I'm right.
Yes, it could happen, but it's not.
Can I interrupt?
Yeah, it's not. Yeah, there is no such significant
Yeah,
interaction between them.
it's about contraceptive. Can I interrupt?
Yes,
It's
Rabi.
Mahfouz.
Mahfouz, yes. تفضل يا باشا.
It's about smoking and contraception. Since she's 37,
السلام عليكم.
and she's taking combined contraceptive, and she is now 1 pack of smoking. So this will
Yes.
interact together.
Yes. So here is a contraindication. She's 37 and she smokes a pack a day. So smoking here is not a choice. She has to stop smoking right away or stop the contraception. Okay? This is an important point. Okay? You didn't remark it, right? Okay.
No, I didn't. No, I didn't.
Yes, this is number one. This is number two. So now we cover two concerns. What about the other one, the last one?
Yeah, I have a question actually. Citalopram is taken one tablet. What's DIE?
Sorry, it's in French. It's in Quebec. We use it in Quebec. Yes, sorry. It should be once daily or QD. In Ontario, it's a QD.
Okay, so it causes insomnia. So if it's taken at night, it should be taken in the morning.
Yes, she takes citalopram in the morning.
Okay. Okay. Then it's not.
Yes.
Okay.
Yes. Okay. So what about the? Go ahead. Yeah.
I couldn't understand very well that you increase the smoking or decrease the smoking.
Sorry, would you repeat that?
You mentioned that you have been smoking 1 pack per day, as I understood.
Yes, she smokes 1 pack a day.
And he increased or decreased it because the interaction between caffeine and
no, she used to smoke 2 or 3 cigarettes per day, but she has augmented her smoking. Her cigarettes from 2 to 3 to a pack a day to 20 per day. Okay.
It's increased smoking and
Yes. The point is yes. The last point, yes. Last point is what Iman mentioned. Yes. Talk to his doctor to increase the dose of citalopram to 20 milligrams. This is a very weak dosage of citalopram. 10 milligrams is a very weak. Okay, in an anxiety, usually we use more than we can exceed the recommended dose of some SSRIs. You know that? For citalopram, we can go up to 60 milligrams in an anxiety conditions. In some anxiety conditions like OCDs.
60?
Yes, we can go up to 60. In like if she's obsessive or I think this is a previous recommendation. The last recommendation says that we can go up to 60 milligrams even in anxiety conditions. Okay, but it's not really recommended, and you should have the patient consent in that. Okay, but the point is that for SSRIs we should use usually the maximum dose in an anxiety. Okay.
Sorry, I have a question, but she was okay with 10 milligrams during the last year. I mean, the stress, recently stress has made her, to be a class problem. So why do we need to just increase the dose?
Because she's stressed now, and there is why not to increase the dose?
I believe it's a transit situation, not something that medication isn't working for her.
Yes. Okay. So here it's judgmental. So it's about your judgment. You can fax her doctor to increase the dose to 20 milligram. This is number one. Number two, you can tell her you need to wait 2 weeks to see your doctor and ask him about the citalopram dosage. If you need to increase it or you can keeping it as it is. Number 3, you can say, as you said, it's only a transit situation, so we don't need to add any medications. This is number 3. We have even a fourth choice, which is you can add a benzodiazepine like lorazepam or any other thing for a period of 2 weeks, for example, if you would like, according to the recommendations. Okay, so we have here about 4 valid choices. But for me, I think citalopram dose is very weak. It should be increased to 20 milligrams. Especially there is no contraindications. Huh? She's still young. She's 37. No other medications, no other significant drug interactions. So I believe you can go up to 20 milligrams with no problems. Okay, so.
Sorry, may I ask a question? The thing is, for this case, I do believe that we better just emphasize on the non-farm, because I think if I'm wrong, please just correct me. I think even if you take the medication, but if you don't take the measure of non-farms, it won't work. So the number of caffeinated beverages, I mean, the smoking and doing no exercise, these things must be corrected in a way that just give the best.
Yes,
I mean,
correct. Yes.
So
definitely yes. It's very sleep hygiene is number 1.
Yeah.
You should always start with sleep hygiene, and if you would like, you can add an over-the-counter medication or no. It's according to the situation you have.
Okay, so can we
sleep
just
hygiene? Yes. Yeah. Go ahead.
Sorry. Can we just recommend stick to the non-farm measures first? If it doesn't work after a week or some days, just come and I just give you some over-the-counter medication such as melatonin or valeriana. Or
this is what Mustafa asked. I think Mustafa and Tariq asked about this point. You should stop smoking and you should stop caffeinated, and she said no, I cannot.
Okay.
So she refused to stop the caffeine and the smoking.
Okay, good. Thank you.
Okay, so any other comments? Should we proceed?
يا لازم limit الالكوهوليك beverage لأن هي تشرب 4 باليوم.
No, caffeinated beverages.
Alcoholic beverage.
No, she doesn't. No, she doesn't drink alcohol. She said no.
Oh, okay.
Caffeine. Okay. So as we said, today we're talking about the multi-concerned stations, station with 1 or 2 or even 3 concerns. Okay.
Okay, Muhammad, the next station.
Yes, let's go. We have ممدوح رفع ايده تاني اهو.
Okay, Mamdouh, do you have a calculator, please?
Okay, sure, yeah.
I'm sorry.
Iman, yes. Iman says 40 milligram. Yes, for citalopram, as I said, 40 milligram is the maximum dose, recommended dose for citalopram. But in some certain anxiety and obsessive conditions, you can go up to 6 milligrams. With guys, please mute. Okay. But in certain anxiety and obsessive conditions, you can go up to 60 milligrams with the patient consent. You should have the patient consent as a physician. Huh?
Doctor, good morning.
Yes. Good morning. Who's gonna participate? Mamdouh, do you have?
Yeah, I'm ready. Yes, I have it.
Doctor, Doctor, please, I have a little concern about the monitoring period. I don't see the reference, but it is not 7 days. I think after 3 days, because in the OTC sleep aid, after 3 days, if no improvement, I will refer the patient, not 7 days.
Yes, this is correct. But here, melatonin is safe. There is no problem from melatonin. But as you said, yes. Usually, if he tried the over-the-counter medication for 3 consecutive days, and there is no
Yes.
improvement, yes, he should go to see a
Yes,
doctor.
because our colleagues said 7 days. Not no. It is
Yes,
according to the organism of the insomnia and the sleep aid OTC.
he
After
said,
3 days.
Armia, he said 3 days first, then he said no, 1 week. First he said,
Yeah.
but I know it's according to CDMA, it's 3 days. Yes, you are right. But here, melatonin, there is no, you know, it's safer even than the diphenhydramine. And there is
Yes,
no.
it's safer. Okay.
Yes, you can
That's
say
okay.
it's accepted, but better to say 3 days, as you say.
Yes,
But
that's it.
7 days is accepted for I think for any assessor it would be accepted. But
Okay, Mamdouh, let's
Yes.
move on to the next station, please. Okay.
Thank you.
Okay, I send
Yes,
you a reference actually. Okay, I send you a reference on the WhatsApp group. I'm not sure if you have an access on it or no.
Yeah, I do.
Okay, right. When are you going to start? Faid, can you start the timing, please?
Sure. With a 30 minute or without 30 minutes?
30 minutes, 30 seconds, yeah, 30 minutes.
30 seconds.
30
Okay. Start.
ماشي.
Okay.
Yeah, start تديله كده 20 seconds كده وبتاع وقول لي so we can start.
Okay, you can start.
yes, here's the patient file.
Yes, you have a patient file, and I already sent another reference. Okay.
Okay, so something on the screen. Okay. For a practice. Okay, yeah. Hello, my name is Mamdouh. I'm the pharmacist. How may I assist you today?
Hi, Mias, are you the pharmacist? I'm looking for something behind the counter or even over the counter for my heartburn. I heard like you guys have Nexium behind the counter or something like that. Can you give it to me, please?
Sure, I'll do my best to help you. First of all, would you like to have a seat in our private counseling area so we can discuss this further?
Yes, no problem.
So, may I get your name, please?
My name is Fawzia McMaster.
Okay, and how are you doing today, Fawzia?
Not bad.
Okay, so can you please tell me more about your symptoms?
Actually, I take some medication. I have my file with you, and I was reading on the internet that's one of the medication can cause like heartburn. So I would love to have it like in stock just in case something happened.
Okay, but right now you don't have any problems with the medication, is that correct?
No, not for the moment, no.
Okay, you just need something just in case.
Just in case it happened, yeah.
Okay. And let me just go over your profile real quick. You're taking Resindronate 35 milligrams, 1 tablet weekly.
Yes.
Can you tell me how do you take it?
I take it with food, actually. I take it with food while watching my morning show. I usually take it in the morning, every Sunday.
Okay, every Sunday in the morning. Okay, and you're also on Candy Sartan 8 milligrams, 1 tablet daily. Do you take that regularly?
Yes.
And why do you take it?
For blood pressure.
And is it controlled?
It is controlled.
That's good to know. And for the aspirin, 80 milligrams?
For the aspirin, I take, yeah, for blood thinner.
Okay, and when do you take it?
First thing in the morning as well.
In the morning. And you told me when do you take the Candy Sartan?
I take everything in the morning.
In the morning together. Okay. Okay. Okay, so do you have any allergies?
No allergy, no.
No allergies, okay. Do you take any other medication that's other than what's on your profile here?
I don't take any other medication, no.
Nothing over the counter or herbals or supplements?
Yes, that's my second question, actually. My doctor said you have to take calcium and vitamin. I take, he told me about the vitamin strengths, 1,000 capsule a day, but I'm not, I don't remember the strengths of the calcium he told me to take a day.
Okay.
However, I brought to you my diet regimen. I'm sure the dietitian said it's the maximum I can get is 1,200 milligrams a day of calcium, and I want to know how many calcium capsules should I take?
Okay, I'll take a look at that for sure and tell you if you do need any more calcium. Okay. Regarding your lifestyle, as this sometimes affects how the medication works, do you smoke?
Yes, I
am. May I know how many cigarettes per day?
15 to 20 a day.
Okay, so regarding smoking, as you know, it's really important to try to quit. So if you would consider that, we can definitely help you with that with multiple programs here at the pharmacy.
Mm-hmm.
Okay. How would you describe your diet to me?
I usually eat from outside, like junk food and stuff.
Okay, I see. And did you get a chance to exercise?
No.
Okay, so your main concern here is you want something for your stomach in case you feel problems with risendronate. Is that correct?
Mm-hmm.
Do you have any other questions or anything else you would like to ask about?
No.
Okay, just allow me a few minutes and I'll be right back with you.
Okay.
Okay, regarding your calcium, I'm looking here at what the dietitian recommended. For the milk, how many cups do you get in the morning? Just one or more?
Everything is written on here, whatever I take, actually. I take one.
One, okay, yeah. Okay, so one milk in the morning and then orange juice, also one at supper. Is that correct?
Yes.
Okay, so 700. Okay, so, thank you for waiting. So a couple of points here I'd like to talk to you about. First of all, for the risendronate, it's very important that you take it the proper way in order to prevent any heartburn or any side effects. And this means taking it the first thing in the morning before any food or drink. You need to take it with a full glass of water and only water, no other drinks. And then wait at least 30 minutes before you take anything else by mouth. So no other medications, no food, no anything for 30 minutes. And it's recommended to stay in the upright position for this whole 30 minutes. If you take it this way, it lessens the chance of having any side effects with your stomach for the medication. Does that sound good to you?
It sounds good, actually, but however, I doesn't take it that way. I take it while eating and lying down, watching my, as I said, watching my show in the morning. So that's not the proper way to do.
Yeah, if you can change that to take it the proper way, I'm sure that will protect you from any problems in your throat or your stomach. Okay,
okay,
and then you can
space.
Yeah, you can space the other medications. You can take them after at least half an hour.
Okay.
Yeah. For the calcium, as your doctor told you, you need 1,200 milligrams per day. Based on the document you shared with me, you are already taking 700. So what you need is just 500 milligrams of calcium. You can take that in form of calcium tablets, and it's important to space it from the risendronate as well. So you might take that at maybe after lunch or something, or with lunch. That would be to complement that 1,200 that you are supposed to take.
Okay, so one tablet of 500.
Yes, that's correct.
Okay, that's it.
Do you have any other questions?
No, I don't.
Okay. If you have any other questions, feel free to contact us at any time. We'll be happy to help.
Okay, thank you so much.
You're most welcome. Have a great day.
On time.
Okay, Mahmoud was doing that with me, right? Mamdouh, sorry. Okay, Bish. There are two actually your performance is amazing. Like I love like the way of communication you're doing, and you hit on some points. However, you missed 2 points. One point you didn't ask about the alcohol. I don't know if you remember this or not.
Yeah, I know. I just was thinking it's not very relevant, so I didn't touch on it. Yeah.
Okay, so this lady was actually drinking alcohol. However, regarding the smoking part, you offered like smoking cessation settings, which is very good. You asked about exercise. I said I have no chance to exercise. You didn't mention on it any information or anything. The other thing you missed the follow up. You're gonna dispense calcium. Okay, you said 1 tablet 500 milligrams. There's gonna be a side effect. There's gonna be constipation side effect, right or wrong?
Right.
Exactly. So when you dispense something, you have to follow up with it, either like an efficacy or an side effect, which is here the very important. That you're gonna have actually constipation in maybe like 3 or 4 days from the start of calcium, right? So that's very important. Otherwise, like I would give you fully solved. بصراحة. You were calm, you were confident, you offered like a private counseling area, you discussed every single thing with me. You counseled on the Residronate, which is one of the main points here, which I was really happy when you said that. Okay, regarding the main concern, regarding the Nexium, are you going to dispense Nexium or no need? You didn't answer on this. You forgot.
I forgot.
Just
Yes.
tell me, you know what? No need to have Nexium, because if you take it the proper way, that's no need like no need for the Nexium, no need to pay for anything, like you will not need it in the future.
Yes,
So
exactly.
however you said the right counseling points for the Residronate. I would give you fully solved ممدوح بصراحة. تمام.
Yes.
Just
very good ممدوح بصراحة.
Hello.
yeah, very very good. Don't forget, actually, when you dispense something, don't forget the follow up. That's it. Okay.
Hello. May I ask a question?
Yes, you may.
Okay, thank you. Is it calcium elemental for each options? For example, milk 300 milligram in each cup. Is it elemental calcium?
It is elemental calcium, yes.
It should be elemental calcium, yes.
Thank you.
Okay.
So guys, for the previous station, I forgot to mention something very important. None of Tariq, nobody of Tariq or Mustafa, I think, yes, Mustafa or Tariq asked about the pregnancy and breastfeeding, correct? You didn't mention anything about that. For the previous lady, Nicole Saba, she's taken Alice, but you still required to ask about the pregnancy and breastfeeding. Okay? So just keep in mind this. Okay, any other comments, Ghazouli, you would like to add for this station?
No comments. Actually, you did it very, very good.
Okay.
Let's continue to the third.
كنا عايزين نرشح ممدوح في الستيشن الأولى بس فعلا. Okay. Station 3.
There is a concern here for Annie. Give me a second, Muhammad, please.
Yes. Interaction of caffeine.
Interaction with caffeine beverages. Annie, he didn't ask for caffeine beverages. However, there is, if he would ask, there is no caffeine intake. The point is he didn't ask for it as well. He was lucky because there's no caffeine intake. But the main issue here is the calcium part. That was my main concern. That since he's gonna dispense calcium, so she's gonna experience some side effect here. Okay, so that's the main issue. So and I don't think the point here is valid. Like interaction with calcium and caffeine. It's not one of the main concerns for the station here. Okay.
Excuse me, I have a question, please. Is taking bisphosphonate with food the cause for stomach upset? Because I know that the problem with taking bisphosphonate with food will affecting the absorption. So yeah, it will affect the absorption of Residronate. But does it cause the stomach upset?
When he asked me how do you take it, I said I take it with food, lying down in bed, watching my morning show every Sunday. So all these situations will cause actually esophageal inflammation. This is not the right way to counsel. This is not the right way to take biphosphonate in general. Okay.
Okay. Perfect. Yeah. Now it's clear. Thank you.
Yeah.
Okay. Station 3. Let's go. Who's next?
Hey, good morning. Can I solve it? Station 3.
Yes, sure. Noor Hadi. Yalla bina.
Yeah.
Do we have any question? Yes, no, yes. Does patient need to be more assessed before she's more than 50 and she's
She
small?
already assessed from her doctor, and her concern here, she forgot, or the doctor didn't tell her the strength of the calcium she needs to take. However, she remembers, she was a nice patient, and she remembers the limit every day. Okay, so here the pharmacist has to help her to get the right strength. That's it. She already came from the assessment, my friend.
Okay, for this station, we have like a kind of, it's a long reference, but you don't need to go through it all. I have just highlighted the important points you should focus on, right? Treatment of menstrual migraine. And here you have preventive therapy. Just focus on those two parts.
Okay.
Okay, Noor? We can skip all the other things. Would you like me to send it to the WhatsApp group?
No, it's fine.
It's fine? Okay.
Yes, please. Can you send us for us
Yes, no problem. One moment.
to open in the computer? Thank you.
Yes, Homer. Just one moment. Okay, I'm sending it now. You have it. Okay. يا فايد.
Yes, go ahead.
مش عايز تبراكتس يا فايد ولا ايه؟
يا ريت.
تعالى يا عم خد الستيشن الجاي.
اوكي.
ده ما انت قاعد مستخبي كده. Okay, so let's start. 30 seconds. Here you go.
Okay.
Okay.
فايد are we okay?
مين فايد؟
فين فايد؟
يس موجود، انا روح خلص.
انا كان في 30 ثانية نبتدي. Okay.
Yeah.
Are you the pharmacist? Hello?
Excuse me, is it me or Fayed who will answer?
It's you, Noor. It's
Okay.
you. We should start now.
Okay, okay. Hey, good
Yeah.
morning. This is Noor, the pharmacist. How can I help you?
Yes, Noor. My name is Dr. Joe Biden.
Yeah.
I'm working here at the hospital. And I'm looking forward to have your recommendation about one of my patients.
Yes, sure.
Okay. Yes. She's
What's
a
the-
lady. She's 32 years old. And I think you have her file here.
Okay, I see. She's taking rizatriptan and candicertan. What's the problem with her?
Okay, so it's a long story. Here for this lady, I prescribed her rizatriptan since about 3 months ago for her migraine episodes.
Okay.
She used to have like 10 episodes per month. Okay.
Oh, wow. Okay.
Yes, about 10 episodes. Most of those episodes happened during the week of her menstruation. She had about three or four episodes during this week. I consider to give her a preventive measure like candesartan 60 milligrams since 2 months ago. And it seemed effective actually in terms of the intensity and the frequency of the migraine episodes.
So you mean, okay, you mean when she started taking candesartan, she had less episodes?
Yes, now she has, yes, she's suffering about 5 or 6 episodes per month. But still, I think she has something related to her menstruation because she still suffers from about, usually she has 3 episodes during her menstruation week.
Okay, so I see that it might be the rizatriptan is not the appropriate medication for her. But before that, I want to ask you a few questions. So does rizatriptan help her to relieve her symptoms, like when she
Yes.
takes?
Yes. Yes. Usually she takes only one tablet, and rarely she would repeat the other. She would repeat another tablet, but it doesn't happen usually.
Okay. I may ask you a few questions about her lifestyle, if you know any.
Yes.
Okay. Does she take any alcohol?
No, I don't think so.
Any caffeine?
No, I don't. No.
Okay. Does she smoke?
Smoke? No, I don't believe that. No.
Is there anything rather than her menstrual cycle triggers her symptoms?
I don't know, but no, she's
Okay.
only telling me about her menstruation, nothing
Okay.
else.
Does she take any other prescribed medications?
No, other than that, no.
Any over-the-counter medications?
I think yes. Sometimes she takes like ranitidine or something for her stomach upset.
Okay. And any herbal supplements or minerals?
Yes, she takes vitamins.
Does she have any allergies?
No.
Okay, doctor, can you give me a moment just to check my references?
Yes.
Okay.
Sure. Take your time. Just let me know if you need me to scroll down, okay?
Okay. Mhm.
2 minutes.
Okay. Okay. Okay, doctor. As I see that her symptoms related to her menstrual cycle and her medication can be certain is effective a little bit, but something that we can work on is changing or adding another prophylactic treatment using another medication like provatriptan. Provatriptan has evidence to reduce migraine related to menstrual cycle. So what I recommend you is starting with her frovatriptan 2.5 milligrams daily. And
but she's already taken the rizatriptan.
Yeah, rizatriptan can be discontinued and start frovatriptan as a prophylactic therapy daily.
Okay, even it's effective, because rizatriptan is very effective. I tried something before, but it wasn't effective.
Yes, but this medication will be taken in a daily basis.
For frovatriptan, it will take it every day?
Yes.
Okay.
Yeah, like 2.5 milligrams daily. That might help her to reduce the episodes of migraine.
Okay, and she will continue the candesartan.
Yes.
Okay, you know what? I was thinking about the contraception, because she's 32 years old, and I do believe that giving her a contraception would help her. What do you think about that?
Yes, I think if you start with her, if she doesn't want to have babies, starting progesterone only pills will help her.
Okay, continue, please. You have 30
will
seconds.
will help her in like reducing the migraine associated with menstruation. So if starting many pills plus the frovatriptan daily dose, and discontinue rizatriptan and give it a trial for 2 to 3 months and see if that helps.
Okay, so just let me wrap up. You would give her the frovatriptan 2.5 milligrams once daily, correct?
Yeah.
And progesterone only contraception, correct?
Yeah.
Along with the candesartan, right?
Yes, and we might in the future like discontinue candesartan and just stay on frovatriptan.
Okay, perfect. Thank you so much, pharmacist.
No problem.
Have a good day. Okay, Noor.
Okay, go ahead.
No, I will not go ahead. I will go for another candidate.
Okay.
I will let you know why exactly.
Okay.
Okay, it's not the right choice. Okay, so
I can do it.
Who's next?
I can do it.
Yes, Fayed?
Yes.
Let's go for it. Okay. Would anyone please take care of the time? Any volunteer?
I can do that.
Yalla ya Mustafa.
Okay. Start?
Yes, start right away.
Okay, I start.
Hi, this is Yusuf, the pharmacy on duty. How can I help you?
Yes, Yusuf. I'm Dr. Joe Biden here.
Hi, doctor.
Fine, thank you. I would like to consult you about one of my patients. Okay,
Sure.
her name is Kamala Harris. She's 30 years old. Okay, she's here. She has file here in the hospital in your pharmacy. Can you see her file?
Okay. Yeah, how can I help you, doctor? What's your concern?
Yes. Actually, my concern is about her migraine episodes. I diagnosed her with estrogen-associated migraines. I had started before rizatriptan for her, like an abortive medication for her acute episodes, and it's working. But usually she had about 10 episodes per month. That's why I considered the candesartan 60 milligrams per day, and it succeeded to decrease the intensity and the frequency of the migraine episodes.
Okay.
But she still has like 3 episodes during her menstruation week. So I'm wondering if you can help me. Can we give her any other medication like contraception or any other triptan you may find of benefit to her, or even an anti-inflammatory medication? I don't know.
Sure, doctor. I just need to ask you a few questions before I give you my recommendation, if you don't mind. Is Harris a pregnancy or breastfeeding by any chance?
No, she's not pregnant.
And
No.
how is her like kidney and liver function?
She's fine. No problem.
She's fine.
Yes.
And is her migraine with aura or without aura?
It's with aura.
With aura.
Yes.
Okay, and what I understood that everything is fine, only some a few attacks during her menstrual time of the month.
Yes.
Okay, is she taking any? She has any allergy for medications?
No, she has no allergies.
Is she taking any, like, has any medical condition other than that you mentioned or in her file?
No, that's it.
Okay, is she
Like
taking any other medication other than the candesartan and the triptan?
For the prescription medication, you mean?
Yes.
No, no, nothing.
Okay.
I think yes, she's only taken ranitidine for her stomach upset. That's it. When needed.
Okay, and she taking any over-the-counter medications?
Only ranitidine.
Oh, okay, any other?
No, maybe vitamins.
Vitamins, yes, or mineral herbs.
Yes.
She's taking any kind. Yeah, she's taking any kind of vitamins.
Yes, multivitamins. Yeah.
Multivitamins. Okay, and regarding to her lifestyle, if you know about it, she's smoking.
No.
Is she drinking any alcoholic beverage?
No. No.
Okay, any caffeinated beverage?
No, she's healthy.
She's healthy. Okay. So what I understood, doctor, that you already tried to manage her migraine symptoms, and you already prescribed her the medications, and it's we can say it's working so far. The only problem with her menstrual syndrome, the migraine come with menstrual syndrome. So I would suggest to try to reduce the symptoms coming with menstrual like syndrome or monthly. So according to that, usually we recommended that the patient to reduce this kind of syndrome to start with some minerals vitamins such as calcium. This will be very helpful for her for maybe for 3 months. But because this will be helpful, and I think that I would recommend the patient to start one of the non-steroidals, such as like, let's say, ibuprofen twice daily, or maybe naproxen, let's say 500 milligram twice daily. She can start it like a few days before the menstrual symptoms. Because usually the menstrual symptoms come about 5 days before the menses. So she can start that, and whenever like the symptoms improve after 1 or 2 days with the menses, she can stop using it. This will be helpful for her.
2 minutes.
Yes.
2 minutes. Yeah.
Yeah, so this is my recommendation for her right now. Or maybe she can use, there's a different, like another choice if the patient's well with it. She can start oral contraceptive, any contraceptive. She can use it maybe pack to pack to stop the menstrual period at all if she is not looking to get any pregnant.
Yes, okay. So she can start, you said naproxen, correct?
Yes.
Okay, twice daily? What's
yes,
the
twice daily, like, or maybe less. Maybe can start it once daily. Twice daily will be fine. Yeah, she doesn't have any other problem.
Yes, it wouldn't harm with her stomach upset, because as I said that she has stomach upset, or that she's taking ranitidine when needed. That would be okay.
She can maybe change it to other non-steroidal. There's maybe minor difference between them. One of the is the other kind of like the sorry. Just give me a second, doctor. Yeah, there is another kind of non-steroidal, but it is not one of the like first choices, let's say, in the menstrual. So naproxen will be good for her to relieve her symptoms, and maybe whenever like she can try the ranitidine if she has any kind of upset to protect her symptoms, because she's gonna like use it for 1 week or maybe 5 days, not on regular.
Can we give her a contraception other than that? Can we give her a contraception?
Yes, we can give her if she would like to, but we have to stay away from the estrogen content contraceptive because she has it's contraindicated with her migraine because it's with aura. So the progestin choices will be better for her.
Yeah, time. Okay.
Okay, thank you so much. Thank you so much.
Thank you.
Okay. Why you insisted about the naproxen? I don't know.
Because what I read here, there's mefenamic acid and naproxen. I didn't find any other choices.
Yes. Why didn't you recommend fruvatriptan?
It's contraindicated. She's already taking the triptan. We can't take two.
Why? No, who said that? You can give her fruvatriptan only during her menstruation. This is number one. Number two, you can stop the other one. You can stop the rizatriptan.
Can you give me her file again, please?
Here you go.
And go ahead. Yeah, go ahead.
Yes, she's taking rizatriptan. Okay.
Okay, I can't take two triptan within 24 hours, right? Two kind of triptans, or just I can't repeat the dose of triptans within 24 hours.
You have two choices here. The first one is you can do as Noor did. She stopped the rizatriptan and recommended fruvatriptan. Okay.
Why?
Why? Because fruvatriptan with the evidence in the estrogen associated here. You didn't read the reference, my friend, or what?
No, I didn't.
Oh, so that's why. Here you have. Fruvatriptan 2.5 milligram daily or twice, and naratriptan. Okay, but what is the dose? Because Noor, she recommended the wrong dose. She said the patient should take 2.5 milligram every day, once daily. And this is incorrect. Okay, she can take, for the fruvatriptan, she can start the fruvatriptan 2 days before the menstruation. Okay, once or twice daily for a total period of 5 days. Okay, this is the protocol, the recommended protocol for the estrogen associated migraine. Okay, so this is fruvatriptan, the first choice, and it's more effective than naproxen. Other thing,
Sorry, Doctor,
has already. Go ahead.
Let me just understand. So these triptans recommended in migraine with menstrual syndrome or symptoms?
Yes.
Okay.
Yes, but it would be very weak in acute episodes. Why? Why?
Can I answer?
Yes, Noor.
Because in acute episodes, we need something that has rapid onset, like nasal spray or rapid.
Correct.
Sublingual.
Yes, this is right.
And fruvatriptan is oral.
Yes, or fruvatriptan is a long-acting and with a long half-life as well. Okay, you can repeat the dose of fruvatriptan after 4 hours, not after 2 hours, like rizatriptan, for example. So the best scenario would be we can keep the rizatriptan, okay, 2 milligrams, 10 milligrams, no problem, during 3 weeks, the other 3 weeks while she is not having any menstruation. And during the first week, when she expects to have her menstruation, she can start the fruvatriptan 2 days before that, twice daily, okay? And she can continue it for 5 days and it will be effective. By the way, this is a real case in the pharmacy. Okay, and I treated her like that, and I submitted this file in my to the College of Pharmacists in Quebec, and they said, okay, perfect, this is a good protocol. So it's accepted like that, no problem. You can give two triptans at the same time, not at the same time, for the same patient. Okay, but you should aware the patient not to take both of them within 24 hours. Okay, so fruvatriptan.
Yeah.
Yes, fruvatriptan would be fine. Naproxen, my concern about naproxen is the stomach upset. Correct? She has stomach upset and she's taking ranitidine when needed. Okay, so for naproxen, it's not recommended. And what's the problem with the contraception? No recommended contraception for this lady.
with aura.
Migraine.
She has migraine with aura.
Yes, migraine with aura. It's not recommended. Okay, and it could be even contraindicated. Yes, it's contraindicated. With migraine with aura, we cannot give contraception. Okay, so we have 3 choices here: non-steroidal, triptans, or contraception. We excluded 2, the non-steroidal and contraception, due to the related medical conditions. So triptans turned out to be the correct choice here, the frovatriptan. You can recommend only frovatriptan alone or in combination with rizatriptan, and make sure not to combine 2 triptans within the same 24 hours.
Excuse me, can we continue candesartan?
You have to continue candesartan.
Okay.
You did the right thing. You continue the candesartan, and this is correct. Do not stop candesartan, because it's effective. It reduces the intensity and the frequency of the episodes. Okay, so it's effective.
Doctor? If we suggest frovatriptan as a prophylaxis, what will be the abortive treatment during menstruation if she has an attack? Would it be naproxen?
As I said, frovatriptan is not recommended as an abortive treatment. That's why I do recommend to continue rizatriptan with frovatriptan.
No, I mean during the week of menstruation. So you are giving her frovatriptan as a prophylaxis. However, she got an attack. What will be the abortive treatment then?
Yes, here you have to give her non-steroidal anti-inflammatory.
Doctor, how about another approach? Giving her for 7 days, 2 days before the menses and 5 days through. We give her naproxen with PPI and keep the rizatriptan as needed for the whole month.
You can do that, but you will prescribe her another medication, the PPI as well. And her condition is not that bad. She's taking ranitidine when needed. That means she suffers from the stomach upset about 2 or 3 times per week. Okay, so there is no need to give her a non-steroidal for that. You can do so, by the way. You can give it here, naproxen, no problem. But here you will have to prescribe her PPI.
2 medications.
Yes,
that's
PPI
plus
naproxen. PPI plus naproxen, correct.
Because my concern, if frovatriptan doesn't work as a prophylaxis, will NSAID work as a abortive treatment in her case?
Yes, you can give her naproxen. What is the dose in abortive episode, like an abortive treatment in migraine? There is a dose, you know that, for naproxen to abort the migraine indication.
I'm not sure. Is it a high dose?
Yes, it's about 1025 milligrams.
Okay. That's the abortive.
This is the abortive treatment. Yes, this, and you can repeat it. I think once. You can repeat it once in 2 hours or 3 hours.
Okay.
So there is there is a special dose for naproxen in like an abortive treatment. It's not the 500 milligrams. Okay.
Okay. Thank you. I see. Thank you.
Clear? Noor, you didn't ask about the pregnancy. You didn't ask about the breastfeeding. You didn't ask about the kidney and liver function. Take care. Okay, Noor?
Yes, sure.
Okay. Perfect.
But what's the problem with liver function? Is it contraindicated?
No, it's not. But you have to check with any HCP. You have like a physician. If you have a physician, you have to ask him about the liver and kidney function. So this is one of your. It's like the professional judgment or professional communication.
Oh, okay, regardless the case.
Regardless the case, yes.
Okay.
And it would be better if you ask him if it's an inpatient or outpatient.
Okay.
Okay. طيب يلا بينا اللي بعده. Station 4 جزوري. جازولي.
يس يا ريس.
يلا بينا.
يس معك سامعني؟ سامعني ولا ايه؟
سامعك يا عم والله.
ماشي يلا.
وغلاوتك سامعك.
اوكي who gonna participate يا شباب؟ عايزين بقى ناس جديدة بقى، عايزين لوسي نبيل وميلاد وماركو ونانسي ونيفين.
مارك بتاعنا ماركو مراد. ماركو مراد
هاتوا ماركو مراد هاتوا.
قلنا ماركو مراد.
يس. مين يا شباب؟ اني.
We need a candidate. We need a volunteer.
آية باكيستا. any volunteering. طب ايه تخش انت محمد طيب ولا ايه؟ طيب اعمل ايه طيب؟ باني. اوكي let's do this. Okay. Do you have a pen and paper, Benny? I would like you to have pen and paper because it's gonna be like some notes on it. Okay. This one, just let's say the door note is like a patient coming in with a concern. You have to deal with her as in practice. She's not one of your patient actually, so there's no patient profile. Okay. When Faid wants us to start, let's start.
Okay, sure.
You can start.
Hi, I'm Patty, the pharmacist in duty. How can I help you today?
Hi, can you give me something over the counter as an antihistaminic for my allergy?
Yeah, sure. Please have a seat. Here is the confidential area. So may I know what's your name?
My name is Hoda.
Hoda, how old are you?
I am 30 years old.
30 years old. And may I know what's the symptoms that you want an antihistamine for?
I have a seasonal allergy and I'm coughing, have some headaches and fever. So my friend actually recommended an antihistaminic, a good one, preferably non-drowsy.
Okay, sure. So is your friend a physician?
No, just a friend.
So may I know how long do you have these symptoms?
It happened actually yesterday. It started yesterday.
Okay. And have you talked about these symptoms to your physician?
No, he's off for a week.
Oh, okay. May I know how bothersome are these symptoms? Does it interfere your life? I mean, sleeping?
They are mild for the moment, actually. They are mild, but I want to get rid out of it before like getting worse.
Okay, sure, I can understand. I'm gonna do my best to help you in this regard. So have you used anything for these during this day? You just told yesterday, yeah?
It just started yesterday. No, I didn't use anything. No.
Okay, sure. So to give best recommendation, Hoda, I need to ask you some questions. May I know if you have any allergy? I mean, you just mentioned you have seasonal allergy, but anything specific, medication?
Yeah, to naproxen and ibuprofen.
Okay. And any environmental factor or any food, anything?
No, not any food.
Okay.
Just dust and mites, and that's it.
Okay. And you have seasonal allergy, right? So do you have any medical condition other than this?
I'm diabetic.
Diabetic. Okay. And may I know what's your last numbers? How is it controlled?
They're controlled, yes. They are very controlled.
Yeah. May I know what was your A1C, your last lab work?
It was 7.
Okay. And how about fasting blood glucose?
Sorry, the fasting?
Yeah.
It was 6.
Okay, that's perfect. So may I know what you use for your diabetic?
What I use for my diabetes?
Yeah.
Like medication?
Yes.
Okay, I use Lantus 20 units at bedtime, and I use Humulin 4 units 3 times a day.
Okay, thank you. Any other over-the-counter?
I don't take any over-the-counter medication. No.
Herbal, samples, multivitamins, anything else?
No.
Okay, you know what, Huda? Lifestyle has some influence on the medical condition. May I know how many caffeinated beverages you drink?
I don't drink any caffeinated beverages.
No caffeinated beverages. How about alcohol?
1 cup of red wine at night.
Every night?
Every night.
And how about smoking?
I smoke between 4 to 5 cigarettes a day.
Okay. You know, smoking is not good for general health. If you want to, just quit it. I will be more than happy to help you in this regard. May I know how do you describe your diet?
I try to make my own food at home, so I think it's like healthy, I believe.
Okay, good, perfect. How about exercise?
I walk 30 minutes every day.
Oh, that's perfect. So, any chance of pregnancy or breastfeeding?
Yes, actually, I'm pregnant.
Oh, congratulations. May I know the in which trimester you are?
I am 2 weeks to be due.
Oh, congratulations. So, you just mentioned that you have coughing, runny nose, anything else? Do you have itching in your eyes or?
No, I have cough. I said I have cough and fever and headaches.
Oh, a fever. And may I know what's the number of fever? How is it?
38.5.
38.5. Okay. Thank you so much, Hoda. The thing is, I have a concern because you are pregnant. I prefer not to give you any medication right now. And the only thing that I can do just give you some saline to just wash your nose, you know, just wash the irritants from your nose and let just ease the symptoms, let's say. But because you have fever and you're pregnant, I do recommend you to go and see your doctor. It's safer for you. Am I clear so far?
Yes, you're clear. But I said my doctor is gonna be here like in a week.
Yeah, I know, but you can go walk-in clinic. You know, your symptoms must be assessed to be sure that
I
you
don't
and
want to
your
go to a
baby are
walk-in
okay.
clinic. Can you give me something, my antihistamine, please?
Well, antihistamines are not usable for a too big pregnant lady. It's not safe for you and your baby. So unfortunately, I can't give you anything. The only thing that I mentioned, you can just use saline. By the way,
1 minute left.
there are
1
some
minute.
non, okay, there are some non-measures that can help you. Just keep hydrated, and for your fever, not to wear too much, lots of clothes. Just wear light, and maybe the keep the room hydrated is good for you for ease your cough, and that's it. Anything else I can help you? Am
So
I
you're gonna give
clear
me
so far?
saline. You give me saline to
Yeah, saline
have it
nasal.
like for nose.
Yes, yes.
Okay,
This
thank you so much.
the the allergens from your nose, and I'm gonna call you tomorrow to see if everything is okay with you.
Okay, okay. Thank you.
Not a problem. Have a good one.
Thanks. Bani, it's wrong. It's totally wrong. I will discuss with you why it's wrong, and the recommendation you give me, it's non-relevant. Okay. Is there anyone who want to do it, or do you want us to discuss it right away?
Can I do it?
Who? Noor?
Yeah.
Okay, Noor, let's do that.
Yeah.
Said, can you start?
Yes, go ahead.
Hi, may I speak to the pharmacist, please?
Yes, I'm Noor, the pharmacist here. How can I help you?
Hi, I need something over the counter as an antihistaminic for my seasonal allergy.
Okay, I'll help you with that. But first, may I ask you a few questions?
Yeah.
Okay. For what reason do you need antihistamine?
I said for my seasonal allergy.
Okay. Can you describe to me what symptoms do you have?
Yes, for sure. Yesterday I got some symptoms, mild though, fever, headache and cough.
Okay, do you have any sputum with cough?
No, it's a dry cough.
Okay. Do you usually have the same symptoms at the same time of the year?
I don't think so.
So this is the first time?
Maybe happened once before, but I usually prefer to take something like over the counter because the symptoms are mild now, and I don't want it to get worse.
So what kind of medications did you use to take in your last last time?
For my seasonal allergy, if you're asking, I used to take cetirizine. That's non-drowsy.
And that helped you?
Yeah, it helped.
Okay. So you told me that you just yesterday get the symptoms, right?
Yes, it happened yesterday.
Okay. Do you have any medical conditions?
Yes, I'm diabetic.
Okay. Do you take any prescribed medications?
I take diabetic medication, insulins, 2 kinds.
And is your blood glucose controlled?
Yes, it is controlled.
Okay. Do you take any other prescribed medications?
No.
Do you take over-the-counter medications?
No.
Any herbal supplements or minerals?
No.
Do you have any allergies?
Yes, NSAIDs. Towards NSAIDs, yes.
Okay. Do you have
naproxen and ibuprofen.
Okay. Do you have any environmental allergies?
Dust towards dust and mites.
And any allergies to food?
No.
Are you pregnant? Or
Yes,
breastfeeding?
I am pregnant. Yes.
Okay, congratulations. What's like how many weeks?
I'm due in 2 weeks.
Okay. I hope you will have a good delivery.
Thank you.
Okay. Okay, may I confirm your name, please? I forgot to confirm your name.
Huda. My name is Huda.
Okay,
yes.
Huda. Huda, as I see, you told me that you have fever, headache, and cough, and these symptoms are not consistent with allergy. Yeah. So I might afraid that you have another condition, maybe like viral infection or cold, and yes, and I think that you must be assessed like by a physician as you are pregnant. So is that possible?
My doctor said is coming in. I have an appointment next week, and I would like to take something over the counter before things get worse.
Okay, sure. Okay, you just asked me you want antihistaminic medication. I think this type of medications will not help you a lot.
It will help me a lot?
It will not, as like you have the symptoms that you have. I don't think they are allergy symptoms. So something I can recommend you to take as Tylenol, the regular one. Yeah, and we might wait for tomorrow or another 24 hours to see if the symptoms are relieved or not. And then I follow up with you to make sure that it's a viral infection and you don't need any antibiotic. If symptoms do not resolve within 24 or 48 hours, you might see a doctor. Like I know your physician is not available. Yeah, I know your physician is not available right now, so you might go to emergency department.
Okay.
So, but meanwhile, I'd recommend you to take Tylenol for your cough and your head. For your cough, you might need to increase the humidity in your home. and drink warm tea or warm drinks like tea or not alcohol.
Tea with
but
lemon
like,
and honey. Tea with lemon and honey.
yeah,
I
like
will try. I know.
yeah,
I was trying.
yeah, and
I'll
your
try.
and Tylenol for fever and headache, and I will follow up with you and see if there's an improvement or not.
Okay.
Okay. Another question. Do you do any specific like? Do you avoid any certain actions that increase dust mite in your home?
Yes, I do.
Okay, that's great.
Yeah.
So, okay, Huda, I'll see you within 2 days. Have a nice day.
You're gonna see me in 2 days?
Yes.
For what?
I just want to make sure that your condition is resolved and
You can call me, okay?
Yes, sure, I will call you. Yeah, sure.
Thank you so much.
Do you have any questions or concerns so far?
No, thank you.
Okay, thank you. Bye.
باي باي ماشي يا ستي. طيب I'm not happy with the performance too. Actually, both of you missed like one of the main concerns here, which is the diabetes. How to control this is actually I'm not sure if you guys come across this one or no. Diabetes sick days. If you heard something about this, please read it. Okay. This lady, first of all, this lady does not have allergy symptoms. If you do the rollout, if you do your assessment properly, we will agree that she's having a mild viral infection, which is common cold, which is easy, come across anyone during any time. This lady is diabetic. She has gestational diabetes and she's pregnant, so her immunity is weak. No one mentioned to me, what about your vaccine? Do you have your vaccines updated? So this is number one. We discussed this point before and so many times, and again, no one mentioned it. That's very important. Number two, you have to tell the patient, listen, you have an infection, okay? And you're diabetic, so it's your blood sugar is going to be like up and down, so you have to adjust accordingly. So that's one of the main concerns here and under patient care main points actually. Okay, so diabetes, no one touched the diabetes. Oh, you're diabetic, you're good. Yes, I'm good because I wasn't in any kind of effect. I wasn't having any infection, but now you're infected. So your diabetes is expected not to be good. So you have to inform the patient that's going to happen. Okay, any infection with diabetes, the blood sugar will be messed up. So you have monitor more. That's what the pharmacist, I was expecting anyone to mention it actually, but no one does. You have to tell the patient, like, you have to monitor more your blood sugar because your blood sugar is going to be high because you're have infection now. That's number one. Number two, you have how to adjust it. If it's high, you have to increase 2 units from Lantus and then monitor more. And that's how it goes during the sick days. Okay. Number three, this is actually the other candidate, the second candidate did a very good assessment, and she said, okay, listen, that's not an allergy, that's a viral infection. So saline, which was mentioned by Bani, is not one of the main symptoms. I don't have any, like, no symptoms to give me saline. And Bani, you mentioned like antihistaminic is contraindicated in pregnancy. She can have like antihistaminic. It's fine. It's not like telling me it's contraindicated. That's not a proper information. Here you can give actually like Tylenol. That's fine. I'm not sure if you guys you can. There is another product you can say. Okay, regarding the headaches, like Helexia. I'm not sure if you're aware of Helexia, but this is not our point. Helexia is a cough syrup that is from a natural product, can be taken. However, if you don't know it, it's not a big deal. You can say this is a viral infection that will go away within like 4 or 5 days. Keep hydrated, wash your hand more frequently, and anyways, you're going to see your doctor in in a week or so. If like things get worse or symptoms get worse, you can talk to your doctor. And the Tylenol here is very applicable because she's having a mild fever and she has headaches. So the Tylenol suggestion that was suggested by the other candidate was very good. This is my notes on this case. Actually, do you have any other ideas so that we can discuss or not?
I have a question.
Yeah, tell me.
The patient
So here,
said,
Noor, here
yeah.
let's agree first before discussing anything. Here, it's a diabetic case. This is not. Yes, this is not a allergy case or an easy case for allergy and how to differentiate between allergy and common cold. Okay, that's if you come across like the diabetes or the guidelines of Canadian guidelines for diabetes, you have to, if there are any sick days, you have to mention how to the patient how to go through these sick days, either type 1 or 2, because they're different, right?
Yeah, but when I asked the patient, she told me that okay, my blood glucose is controlled.
Yes, it was controlled.
Yeah.
Now tomorrow it will not going to be controlled. Obvious. Why? Because actually it happened yesterday. It was mild. So if you're gonna actually monitor tomorrow, it's not gonna be controlled. It's gonna be high. It will come back to you. You didn't tell me about my sugar level. What's happening?
Okay, and
tell me.
And like I thought that the idea of this station was the appropriateness of antihistamine for her condition. So is it possible to have a hidden idea?
No, it's not a hidden idea. If you ask me how old are you, I would say 30. Then the second question, are you pregnant or breastfeeding? I would like, okay, it's I'm pregnant. Do you have any other medical condition? I'm diabetic. And you asked it about all this, and I answered. Frankly speaking, I'm diabetic, gestational diabetes, and I'm on insulin. So it should come across your mind. It's a diabetic patient, pregnant. You have to ask about it's like kinda you have to stick in the back of your mind. Diabetic patient, okay, is there any kind of infection? Okay, I have to talk on the diabetes control during infection. This is the main issue here. Okay, viral infection will go away in 4 or 5 days, but you're gonna be messed up with the blood glucose levels.
Yeah,
that's a big cornerstone here in this case.
Yeah,
okay?
But do you think that in the grading in OSCE, would
actually
they
there is a real case in in the exams.
In
so
the
that
exam.
yes.
So
yes.
yeah, what I mean that we have two questions or two concerns here to solve: the appropriateness of antihistamine and
exactly.
control blood glucose. So if I miss one of them, do I completely fail or?
Okay, I think if you didn't mention anything regarding the diabetes, you lost the 40% of the case, which is the patient care here, because you didn't touch anything. Okay, you know what, Noor? You know what? If you said don't take anything, don't worry about it. It's a viral infection. Let's focus about your diabetes. That's another story. That's you're doing your job properly. Because at you know what, Tylenol. It's fine. You can give Tylenol, no problem, because she has headache or fever or something like that, or achiness, anything. But she will go to her doctor. She will be assessed for this kind of viral infection. It will definitely go away within 4 or 5 days. This is not the big issue here. The big issue here is the diabetes, which is your role as a pharmacist. Okay, so it's very it's tricky, I know, but it's a real case, by the way. Okay, it comes in every now and then. Okay, but the difference between how to tackle this kind of cases like diabetes, either the sick kids, the sick days, and diabetic patient, either on if it's type 1 and taking metformin, gliclazide, and stuff like that, and the other side, when it comes to type 1, like Lantus, and how to tell the patient how to adjust it and to monitor more on all this stuff. You have to mention this. If you didn't mention this, you lost the case. For me, it doesn't matter between you lost it completely or I'm fully solved it. You didn't mention a very important information to the patient, and you let him go without knowing what's going to happen for him tomorrow. You got my point? That's my concern here.
Yeah, sure. So you mean whenever we have diabetes and infection, bacterial or viral, we have to take this into consideration?
Number one. Yes, then we can figure it out, the infection, what's going to happen, This number one. Number two, vaccines. You have to ask about the vaccines, health promotion, okay? No one asked me, what about your vaccines? Is it updated, This issues have to be 1 to 3. Like you have to be in the in like in your mind, like a cliche we can say.
So
Okay.
Muhammad, which symptom the pharmacist said it's viral infection?
Sorry?
Which symptom the patient said? So the pharmacist said it's a viral infection.
The whole symptoms: cough, fever, and mild fever actually, and cough and headaches. That's a common cold. If I told you it's a severe high fever, for example, it happened like 48 hours, that's a flu. Okay. If I told you there is actually like runny nose, watery eyes, that's an allergic rhinitis. You have to roll out what symptoms are this. It's your role here. No one can give you. And I was astonished actually when Bani recommended saline. I didn't actually mention anything regarding my stuffy nose or anything. So I was like, are you gonna give me saline? Why? And I asked her before she leaves, like, is it saline for my nose? I'm like, she's like, yes. She didn't ask me actually what happens in your nose. She assumed that I assessed myself properly, and I'm coming to her. Okay, and she assumed that I'm doing it properly. And the case here wasn't allergic rhinitis. There's like, if you go through the assessment properly, there's no such thing. Okay.
Perfect. Okay.
Okay, guys.
So, are you done, my friend?
Done. Any other question?
Nobody.
It's tricky. I know it's tricky, but we have to get used to this.
Okay. Yes. Korosh is saying that nobody mentioned for NSAID taken during pregnancy, it should be stopped. Okay.
Yeah. Because the patient may start that taking naproxen and ibuprofen. I think they should be stopped during the first trimester of the pregnancy.
Which trimester she was? I'm not aware. Okay, so let's proceed. Station 5, my friends. Hello?
Yeah.
Station 5. Next volunteer. فين الناس؟ iPhone. We have 3 iPhones. Good. We have Ehan, Homa, Hala, Galaxy, Find already there.
Homa. Let's start with Homa.
Yeah, Homa.
Yes. Hi. Yes, I can. Thank you.
Do this, please. Yeah.
Okay, Homa. We have 2 references for this station. I will send it to the WhatsApp group, by the way.
Let me double check.
I will send it. Just
Okay.
2 seconds. There you go. There are 2 references, okay? Station 5A and Station 5B. You got it?
Yes.
Okay. So,
Can I ask?
we have the patient profile.
No problem. I'm going to send to my laptop.
No problem. It's the second reference. This is the first one.
And patient profile, is it in the group?
Yeah, OSCE group. No, patient profile, no. It's only here. I send you only the references.
The references, okay.
Okay, so you have 30 seconds. Should we start?
Okay. Yes, please. Thank you.
Okay,
Yes, go ahead.
Are you going to keep the time? Okay.
Yes, start.
Hi, I'm Huma, the pharmacist on duty. How can I help you?
You have 30 seconds to read the material that you have. Okay. You can read the patient profile and you can have a look on the two references that you have. بقول لي يا فايد لما نبدأ. يلا يا فايد. Let's start.
Yes, start.
Yes.
7 minutes.
Yes. Hi.
Hi, I'm Homa, the pharmacist on duty. How can I help you?
Yes, Homa. I'm out of my blue buffer. Would you refer it to me, please?
Okay. May I have your name, please?
Yes, my name is Big Mac.
Big Mac. Okay, please have a seat in our private counseling area. Everything we discuss will remain confidential. What made you to see the pharmacy today?
It's for my blue buffer.
You need your blue buffer. Okay, and as I see, let me check your profile. As I see, your date of birth is 2003.
Yes.
May 25th. Is that
Yes.
Is that your profile? Okay.
Yes.
And as I see, you have Ventolin, 100 microgram. How do you still take? How do you take it?
I take it 4 times daily. 2
4
puffs,
times
4 times daily. Yes.
And also you can see Fluent 125 microgram. One inhaler BID. Do you still take it?
Yes.
Okay. And the Symbicort 200 microgram. One inhaler BID. Do you take it?
No.
No. When did you discontinue this medication?
I have never taken it.
You don't have it at home.
No.
And also I can see Montelukast 10 milligram, 1 tablet daily. Do you still take it?
I have never taken it.
It says, yes, it says you haven't taken it already.
Yes.
Okay. Why you haven't take those 2 items already?
I don't know. It's my doctor. He told me to take the blue and orange buffers, and that's it.
Your physician told you?
I'm not a physician. I'm a patient.
Yeah, I mean your physician told you not to take these medications.
Yes. Yes. It's enough to take the 2 buffers.
And do you have? Why do you take those, for your asthma or COPD?
I'm asthmatic.
Asthmatic. Okay. And do you have any other medical condition?
No.
Okay.
I have nothing.
Do you have any allergies?
Allergies? Yes, to pollen. I'm allergic to pollen grains. Yeah.
Any medication allergy? Do you have any medication allergy?
No.
No. And do you take any other prescription medication?
No.
Do you take any over-the-counter medication?
No.
No. And do you smoke?
No, neither.
No smoke. Do you do exercise?
I couldn't exercise.
No exercise.
Yes, I used to exercise, but recently I couldn't.
Okay. Recently, we ran out of Ventolin, your blue puffer, and it's in back order. But I do my best to provide you another one to help you. Okay, please let me check my reference. I will get back to you.
Take your time.
Thank you. And is it your asthma well controlled?
What do you mean by well controlled?
How many attacks do you have per week?
I don't know.
Asthma.
I don't know, but I'm using, yes. As I told you, I'm using my buffer 4 times daily, the blue one, and for the orange one, I use it twice daily.
I mean, do you have shortness of breath at midnight during your sleeping?
Sometimes, yes. That's why I'm taking the buffers.
Two minutes.
Okay. Thank you for your patience. According to my reference,
yes,
as we ran out of Ventolin, you can use a Symbicort spray as a reliever. Because you are not going to using Ventolin every day, and it's as needed. So I recommend you take Symbicort as a reliever. You can take it one puff in the morning and one, you can take it 2 puffs.
Sorry,
And,
I do not understand. What do you mean by a reliever?
If you, for example, Ventolin, you use Ventolin when you have asthma attack. Okay, we do not use Ventolin regularly, and no, you ran out of Ventolin. So you can use the Symbicort as Ventolin. If you have asthma attack, you can take a Symbicort 2 puffs, and you can take up to 8 puffs per day. It helps you as a reliever, as a rescue, if you have asthma attack.
Okay, so you mean that I can take the Symbicort? What
Yes,
is it? Symbicort, okay.
Yes, because I can see in your profile, you haven't taken it before, but I will
okay,
recommend
so I should have it at home, huh?
Yes, just have it at home, but do not use it regularly. Use as a like salbutamol, okay, just for when you have asthma.
Are you going to give me this buffer or what?
Yes, I'm going to dispense you Symbicort.
Symbicort, the new one, okay? So
Sorry?
I use it, the new one, the new buffer.
Yes, you can use it maximum 8 inhalers per day.
Okay, so I would take it 2 buffers 4 times daily, correct?
As needed, when you are needed. Yes.
When I need it only. Okay, and what about the other one, the orange one and the blue one?
Yeah, take it regularly. You need to take it.
Okay, so, and you don't have the blue one?
Blue one is back order, and we don't have it. And you
what does it mean, back order?
We don't have. It's not available right now. And if you will be at risk of shortness of breath, you need something as a reliever, as a rescue medication.
Yes, I see. Okay, I will.
Okay.
That's it?
And the side effect of this medication is similar to the fluticasone and blue puffer. You know the side effect. Yes.
Yes, I know the side effect. Thank you so much.
Thank you.
Okay, Homa. Okay, you didn't practice with us before, huh?
Sorry?
You didn't practice with us before. This is the
I
first time?
was just in a few sessions. No. No.
Yes, okay, okay. Okay, so yes, we have some comments about some points. The most important is the terminologies. Okay,
Yes.
you should use the slang language. Okay, you said so many times relievers, and the other thing you said, what is the yes, back order and something like that. Okay, you should simplify your language. However, you missed, yes, you missed some other points as well. So we can try another candidate, and I will get back to you with the assessment.
Thank you.
Okay. Okay, Sahar, do you would like to do this station?
Yes, doctor. Are you able to hear me?
Yes.
Okay, perfect.
Okay, so let's go. يلا فايض على طول 7 دقايق لسحر.
Okay.
يلا بينا.
Yalla,
I would
start.
like to have my blue buffer, please.
Yeah, good afternoon. My name is Sahar. I'm the pharmacist. It's my pleasure to help you with that. May I know your name?
My name is Big Mac.
Hi, Big Mac. How are you doing today?
I'm hungry.
Okay, perfect. Is your date of birth is 25th of May 2003?
Yes, correct.
Okay, perfect. Okay, I do have your file in front of me. So you are taking the Ventolin as needed?
Correct.
Okay, how frequent do you use it?
4 times daily.
4 times daily on these days, or this is what are you
Yes.
doing in the last few days?
It's been 1 week.
It's been like that since when?
1 week, I say. It's been 1
1
week.
week? Okay,
Yeah.
sorry, I couldn't hear you. Okay. Yeah, so you already finished the one that you pick it up on the 10th day ago, right?
Correct.
Okay. What about the Flovent? How did you take that one?
Twice
The
daily.
orange one.
I take it twice daily, and I wash my mouth.
Okay, perfect. And you are taking that one regularly as well, right?
Mm-hmm.
Okay. And you haven't served the Sympicort, and you never served the Montelukast as well.
No.
And that was by Dr. Johnson, and the first 2 things was by Dr. Watson, right?
Correct, yes.
Okay, is your Dr. Johnson is the specialist?
Dr. Johnson, yes, usually he's my yes chest specialist.
Okay, and it was recommended by your Dr. Johnson, but why you haven't served them?
Because Dr. Watson, my family physician, told
Yeah.
me yes, I can go with the other 2 for the moment.
Okay.
No
On that
need
time,
to-
sorry, on that time you wasn't use the blue buffer at that much?
Yes, I used to. Yes, I was taking it about we can say once or twice per week.
Once or twice per week.
Mhm.
Okay. And what happened recently? Any new changes in your lifestyle, or did
I
you
don't know.
exposure to any chemicals? Any?
I don't know. I
Okay.
have no idea.
Okay, no worries. Do you have any allergy to any medications?
No.
Any other medical condition beside asthma? You are asthmatic, right?
Yes.
Okay. Any other medical condition?
No, I have nothing.
Okay. Any other medication beside those?
No.
Any over the counter like Advil, Tylenol?
No.
Vitamins, herbal medications?
No.
Okay. And do you smoke?
No.
Okay. Are you able to exercise these days?
Not so much. No, I cannot.
Okay, I'm so sorry for that. One more questions. Like you are taking a Flovent, is this include once before exercising, or no? You just take it like 4 times a day because you get some shortness of breath.
You mean the Ventolin, the blue
Yeah,
one?
sorry. Yeah, the Ventolin.
Yes, I take it before exercise and as well when needed. But it's been
Okay.
about 5 days that I cannot exercise at all.
Oh, so sorry for that. You know, it's hard for you. Okay. And have you updated your vaccines, like the flu vaccines, the pneumococcal vaccine?
No,
No,
no.
you haven't? Okay. Okay, thank you so much, Big Mac, for sharing information. I just want to take a look over the reference. I'll come back to you, okay?
Okay.
Thanks.
You have the reference.
Okay, Big Mac, thank you for waiting. So according to my assessment, it looks like your asthma is not well controlled. Since you are using the blue buffer more than 4 times per week, that means your asthma is not well controlled and it's not recommended to be used like 4 times a day by 2 puffs like you are doing right now. So what we're gonna do, we have a plan to work together right now before you are able to see the doctor. So when do you think you are able to see the doctor?
Maybe next week.
Next week? Okay.
2 minutes.
Okay. So first of all, we have this one. You can see it in front of you, the page that is show the asthma care plan. We have asthma when it's well controlled. That is mean there is no night symptoms, and the day symptoms is less than 4 times per week. That means that less than 4 times per week. You can exercise without symptoms, or you never use the blue buffers more than 4 times per week. But when you are asthma getting worse or is not well controlled, that's when you get a night symptoms or when you need to use the blue buffers more than 4 times per week, or when you are unable to exercise,
Okay.
like in your
So
situation
are
right
you
now.
going to give me this plan?
Okay.
Are you going to give
I
me that?
will discuss it with you. We're going to make some changes to your medication right now until you are able to see the doctor. Okay?
Okay. Okay.
Can I see the profile one more time, please?
Yes.
Can I see the profile? Yeah, please. Thank you. So according to your file right now, you are taking the orange buffer, 125 mg microgram, 1 inhaler twice a day. So you are still taking lower than, you are in low dose of steroid actually. So what we can do is like we can go to a Sympicort and you can take 2 inhaler twice a day in a state of a Flovent. So first of all, we're going to discontinue the Flovent. Okay. And you're going to start with Sympicort, 2 inhaler in the morning, 2 inhaler at nighttime, and make sure that you rinse your mouth as well. Okay. Okay. The Sympicort, you can use it as well as reliever, but I will give you the Ventolin as well, like whenever you need it. Just keep it with you as well. Okay.
Okay.
Yes.
So you will give me the new buffer.
I will
right?
give you the Sympicort, and we're gonna increase the dose of Sympicort to make to increase the dose of steroid to 2 buff in the
Okay.
morning, to the buff in the evening.
Yes.
And you can use it as a reliever as well. Okay. During this time, I need you as well to we need to update your vaccines. For the flu shot, you have to put a flu shot because you are considered high risk to getting flu and a complication of flu.
Okay. Will it control my symptoms?
Which one? You mean the vaccine?
The new one.
Yeah, the new one, it will help you since I'm increasing the dose. So this is the next step, what we do. When we are taking low dose of steroid, it's not enough to control the symptoms, we go to the next step. And you're
Okay.
gonna
So
watch
you
for
take
that.
two puffs. Yes, 2 puffs in the morning, 2 puffs in night. Correct?
Yes.
Okay. And I see my doctor next week.
Yes. see the doctor next week, discuss with him and if you find any difficulty in the breathing, in the speaking, you experience worsening symptoms at any
Yes.
time, just go to the emergency or call 911. If you
Okay,
find this one is not effective, okay?
I will.
Okay. Do you have any more questions for me?
Thank you so much.
Okay. Try to avoid a trigger as well. Anything trigger your asthma. Try to be in the smoking-free environment and keep yourself well hydrated as well. Okay.
Okay. When can I get my blue buffer?
Sorry.
When can I get my blue buffer?
Hello.
Yes, hi. Can you hear me? Hello? Hi. يا سحر. طيب. We are done. Can
Hello?
you hear me, my friends?
Hello.
Yes, can you hear me?
Yeah, I'm able to hear you now.
It's okay. It's okay. We are done. Perfect.
We are
Okay.
done.
You
خلص التايم.
yes, 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 yes. You
Okay.
solve it actually in a proper way, but you take so much time. Okay, you talk
Yeah,
about
خطرت أنا I missed
yes,
out,
1
yeah.
or 1.5 minutes
Oh
extra.
my God.
But okay.
I
You
think we need to discontinue the orange one. During the
I
day,
told
if
them
we
that.
use Symbicort, yes?
Okay,
Yeah,
repeat
because
that.
you can't use two steroid together.
Yes, she stopped the flu vent. Yes, this is the right action, by the way. And she initiated the Symbicort in a high dose. But you missed one thing. The maximum dose recommended here, it's not 2 puffs. Have you remarked that?
I marked that, but I was not treating I was on long-term treatment. Yeah, I marked that, but I was like
You would simply recommend him that you can
4 inhaler
go up
twice
to
daily
4.
right away. Okay.
Yeah, yes, he can go up to 4 inhalers twice
Yeah.
daily. Okay,
Yeah.
and it's
Yeah.
only for 2 weeks, and you forget to mention that, correct?
Because I haven't gone for that one or that much. I decrease it to medium rather than to go to high right away. Like,
Okay.
yeah, I was thinking to try this one, like to see how it's work. But I have to mention, like, you can reach up to
But you
maximum
know,
that one.
it's not the right technique, my friend. During exacerbation of asthma, what we do in the corticosteroids dose?
We
We
increase
double
the
it.
dose.
Yes. To what extent we increase it? What's the evidence says?
Yeah, increase it to maximum 4 inhaler twice daily.
Yes, there is a clear evidence here. Have you ever read the Sigma trial or something like that?
Yeah, I read
Okay,
it.
so yes, what is the evidence? What's the conclusion? Should we double the dose? Should we triple the dose, or we only increase it like in sporadic way?
No, it's not like when you are, because if you go up to the action plan of asthma, it says like if you are in the low, you go to medium, in the next step from medium to low. But I think this one is like exacerbation, is not only not control. I think I missed this point.
May I ask, the case was for exacerbation of asthma or not?
Yes.
Yes.
How do I know? How did you know it's exacerbation?
Because he used the blue buffer more frequent. It's 4 times a day. Like how come? He says like if it is it is more than 4 times per week is considered exacerbation. That means asthma is not controlled.
Yes, and it's been 1 week that he's taken the blue buffer 4 times daily.
Can I add something?
Okay, go ahead. So
regarding the dose,
I would like to finalize this point. According to the evidence, what we do, okay, in the action plan that we have, if we pass from the green to the yellow, okay, the simple way to do is to increase the dose to 4 folds for the adults of the corticosteroids. Okay, so simply you can increase it to 4 folds. Here you have the recommendation. It's a crystal clear there. Increase BID form to maximum 4 inhalers BID. Only for up to a maximum period of 2 weeks. Okay, so it's clear. Don't concern about the side effects or any other concern you may have. Just do it according to the reference you have. Increase the dose maximum to 4 inhalers.
Sorry, I didn't understand the question. I didn't understand the case. What is the patient concern? What is the patient problem?
You tell me, my friend. You were the pharmacist. You were the pharmacist, correct?
Is written salbutamol PRN.
So
it's PRN, okay?
And you asked the patient, and you told him, you asked him how many times you take the blue puffer, correct?
Yes.
And I said what?
Okay, 4 times daily, yes.
Yeah.
Yes.
I said 4 times daily.
Okay, so what does it mean? It's in
Okay,
the
so this means that his asthma is not controlled, simply speaking, because how do we know that this asthma is not controlled? Okay, here you have the criteria. If he has any disrupted sleep due to asthma symptoms once per week, okay, we are talking about once per week. If he has daytime symptoms 4 or more times per week, cannot exercise normally, and this was the case, need relief for more than 4 times per week, getting cold or flu. Okay.
It's because I asked the patient how many times do you have shortness of breath during the day or night at a sleeping time, and you said I don't know.
Yes, I don't know because I'm taking the blue buffer 4 times per day.
Mm-hmm.
What you can conclude from that?
Yes, you're right.
Doctor,
yes.
I have a question. Can we dispense a prescription that was issued 2 years back? Because the order of Symbicort.
Yes, my friend. This is a very valid point, and none of you mentioned that. What was the date of prescription?
Yes.
Okay.
3 years back, almost. 2 years and 2 months.
Yes. What would you do as a pharmacist? For Sahar, she dispensed the Symbicort, and for Homa as well.
Fax his doctor to get a new prescription of Symbicort.
I will dispense and fax the doctor.
Now we can. The patient.
Oh, what about doubling the dose of orange buffer?
It won't relieve his symptoms because he still has symptoms.
But it's mentioned on the table that he's in yellow area, and then inhaled corticosteroids, we can double the dose enough without LAPA and without ICS.
I think this for long-term control, but for the attack or for the shortness of breath, corticosteroid won't relieve the symptoms.
Okay. So let's start one by one. Okay, first thing for the prescription, you don't have the choice. Who was asking? Noor?
Ranim.
Ranim. Oh, sorry. Okay, Ranim. For regarding your concern, you don't have the choice. You have to dispense the Symbicort. Okay, because this is the situation that you are in. You don't have any reliever medication that you can dispense to this patient. Okay, so the Symbicort is your only choice here. So simply
and I can dispense it?
Yes, sure. You can dispense, as Tariq said, you can dispense it and fax the doctor. But it's
for a new
at the same time, yes, you have to stop the Fluent. You can hold it.
Yes, sure.
Okay, you can hold it. Why we cannot use Fluent alone?
Because it doesn't give relief for acute attacks.
Correct. This is the answer, Mahfouz. Okay.
Okay, doctor,
you need a reliever here. You should, yes,
okay.
You can.
And as a pharmacist, I can initiate Symbicort at high dose, like 8 puffs or 4 puffs per day.
It's according to the reference you have.
It's fine. I can initiate it as a pharmacist.
Yes.
Okay, my second
According to the
question, this patient, does he need to be referred to his doctor because his asthma plan needs modification?
He has
Yeah,
to.
that's my
He has
question.
to be referred. You must refer him
Yeah.
as soon as possible.
So what should I tell him, that I'll give you Symbicort right now, I'll fax your doctor about my recommendation. However, you need to arrange an appointment as soon as possible.
Yes, as soon
And
as
then
you,
I need to mention for him the points of the red zone, that if he experiences any of these symptoms, he has
correct.
to go to the emergency. Is that
Correct.
correct? Okay.
Yes, as
Okay.
Sahar said. Sahar already mentioned that.
Okay.
Okay.
Thank you.
Muhammad, regarding Symbicort, it's always the maximum is 8 puffs per day. Is it regardless of is it 100 or 200?
It's according to the dose he's taking. Okay, he takes a low dose of Fluent, correct? Yes.
Yep.
So here the recommendation says, if any patient got out of control of his asthma or got an exacerbation or anything, the simple way to stabilize his condition is to quadruple the dose of his corticosteroids. Okay, it's according to the dose he's taken. So he's taken the low dose of Fluent. So simply speaking, you can give him the 4 folds of the low dose, the corresponding dose of the Symbicort, which is, I think it would be 100. It's not the 200, correct?
Correct me if I'm wrong. The Symbicort, 2 different doses, they are different in steroid dose, not the formoterol dose, right?
Repeat that, please.
Regarding Symbicort, 2 different doses. Like there's 100 and the other one
Yes,
200.
yes. There's 100 and 200, yes.
Yeah, this difference is related to steroid content, not the formoterol, right?
No, it's corticosteroid, yes.
Yeah, so we
What
can
do you-
go higher with the steroid and just keep the formoterol dose as it is.
But here formoterol, no, it's not. Well, you don't have the choice to do that. Because here it's a combination buffer.
Yeah, I mean, but it's fixed dose in the
Yes,
2
it's
different
fixed
dosage
dose.
forms. Yeah,
Yeah,
that's
fixed
what.
dose.
Yeah.
Okay.
May I say something, like, and correct me? If I would say, like, to the patient, I would recommend him to take Symbicort and discuss with him that Symbicort can be used, should be used as a regular medication twice daily, and can use it as a reliever when or as needed, up to 8 doses per day. And do I have to add anything else rather than just quit Flovent and Ventolin for
No,
this?
for the moment you cannot do anything else.
Okay.
Just recommend him, yes, update his vaccine. Vaccine is crucial here. Okay, and inform him about the red flags or the red zone that he should monitor. If any of those happens, he should go right away to the emergency department until he sees his doctor next week or as soon as he can.
Okay.
Okay.
معلش انا هسال نفس معلش السؤال تاني عشان افهمها. بالنسبه لو كان عنده في الفايل سيمبيكورت 100 اوكي؟
يس.
ساعتها هديله 4 بافس بي اي دي.
4 بافس لو عنده 100 يس هتديله 4 بافس بي اي دي
من 100 ودلوقتي عنده 200 فهديله ب 4 بافس بي اي دي برضه.
لا هنا انت عندك حق. هنا ممكن تديله 2 بافس. You can give him only 2 puffs PID. Correct. Because this is 200 milligrams. It's not 100.
هو غريب جدا ان الريفرنس انا قعدت في ريفرنس كده في شوبرز اللي هو اسمه فيجيلانس صح؟
RX فيجيلانس.
حلو قوي. مكتوب انا غريبه جدا مكتوب برضه فعلا في ال 2 وال 100 الماكسيمم 8 بافس ودي حاجه غريبه جدا.
Yes, 8 buffs if he's taken it's dependent on the dose he's taken. The patient is was previously controlled on. For example, this patient was controlled on the low dose of corticosteroids, correct? Yes, because the total dose was 250 micrograms of fluticasone, which is the low dose, up to 25, up to 500, excuse me. Up to 500, we can say this is a low dose. Okay, above 500, it's moderate, then it's high dose. Other than that, for this dose of Flovent, okay, it's corresponding to the 100 of Symbicort. Okay, so what you need to do here is to quadruple the dose, the corticosteroid dose that he was previously taken. Okay,
I get you.
so this is the evidence, and this is the action plan. Okay, this is only valid for the patient above 12 years old.
I get you.
For children, we cannot do that. There's no benefit from quadruple or even give 5 folds of the corticosteroids dose to the children under 6 or under, excuse me, 12.
تمام شكرا جدا.
Okay. طيب.
دكتور بليز دلوقتي finally we dispense the Symbicort and we don't dispense the blue Ventolin, okay, for him. Finally.
You don't have the Ventolin. You don't have the Ventolin in the pharmacy, Army.
Okay, I don't have, but in a case, I know that, but in a case I have it. In a case, assume that I have it.
ماشي. Okay.
So I will dispense the Symbicort and discontinue.
No, you will dispense the Flovent and the Ventolin, and recommend him to quadruple the dose of Flovent, and take Ventolin up to 8 puffs per day till his asthma is controlled, or see his doctor, or till he sees his doctor.
But لكن طب ازاي انا هعمل كده؟ ما انا عندي نيو جايد لاينز بتقول ان انا هستعمل السيمبيكورت كريفر. يعني انا هفترض معاك
already, you say that you have already in the pharmacy the Ventolin, correct?
اوكي انا اسيوم ان انا عندي الفنتولين والمريض جاي عاوز يصرف الفنتولين.
طيب خلاص، ايه المشكله؟ عايز ايه؟ ما تصرف له الفنتولين وجيبه.
ما هو uncontrolled، ما هو النيو جايد لاينز بتقول لك
what would you like to do?
I would like to dispense the Symbicort because the Symbicort not served yet, and discontinue the Ventolin and the orange and the Flovent. Why? Because if he
لحظة بس لو هو استخدم السيمبيكورت 8 بافس وعنده شورتنس اوف بريث هيعمل ايه؟ ما تديله الفنتولين وخليه عنده، ايه المشكلة؟
No, this
كويس.
is not
لا الكلام ده لا معلش يا دكتورة، هو لحظة بس، أنا هنا هستعمل السيمبيكورت كإيه؟ كريسكيو ميديكيشن مش كمينتنس.
Why you should, what is the benefit of Symbicort over the Ventolin that makes you recommend it instead of Ventolin?
The
new guidelines.
في الفيرمترول اللي يشتغل يعني يشتغل بسرعة.
يا جماعة لحظة. يا جماعة لحظة واحدة بس.
You are thinking about Sigma 2 trials?
أيوه بالظبط، لسه جايبها امبارح.
You're thinking about this, but no.
Yes. أيوه بالظبط. يعني معلش هو
here it's on the long term. It's what is the benefit of Symbicort, okay, over the Ventolin or Flovent? The main what is the main benefit from Sigma 2 trial?
من سيجما 2 ترايل بتقول لك الموست ايفيدنت ان انا استعمل السيمبيكورت حاليا، عشان كده عملوا باك اوردر لكل الفنتورين من شهرين 3 اللي فاتوا، بعد كده يرجعوها تاني، وحضرتك اكيد عارف الكلام ده. النهارده السيجما 2 انا لسه عاملها امبارح، انه قال لك لا، قال لك استعمل السيمبيكورت كريسكيو ميديكيشن، يا ده يا الفنتولين. انا لو صرفت له الاثنين هبقى بلخبطه. هقول له خد السيمبيكورت، استعمله كريفر، ده الموست ايفيدنت ليك عشان تكنترول الازمه بتاعتك، وبعد كده لما ترجع للدكتور بقى بتاعك هيمشيك بقى على دوز كورتيكوستيرويد. هو ده رايي.
Okay, Armia, the endpoint was the annual exacerbation, correct?
Sorry?
What is the benefit of Symbicort? It's the decreased number of annual exacerbation, correct?
بالظبط.
We are not talking about long-term control. We are talking about only a control for 1 or 2 weeks till he sees his doctor next week. That's it. We're not making recommendation to his doctor here.
هو انا
Okay?
كل غرضي
You
يا
can
دكتور ان
do
انا
it.
هشتغل يعني اوكي بس انا كل غرضي ان انا النهارده
Just correct
في
me if I'm wrong.
الامتحان
I know.
في الامتحان
Correct me, my friend. Correct me if I'm wrong. Okay, the benefit of Symbicort, the clinical benefit of Symbicort, okay, was approved over the Ventolin.
That's it.
صح? Ventolin best.
Yes.
Like what?
Yes.
Like a reliever or rescue medication. But what
بالظبط.
about in comparison? Yes. What about in comparison to the corticosteroids? What was the other armats? It was flutic.
لو انا سيجما 2 بتقول وحضرتك اكيد عارف وكروبتي مين لو انا غلط، لو انا هستعمل الفنتولين مع اي سي اس اللي هو زي الحاله بتاعت الكيس دي، يا ده يا ده يا ده يا ده، this or that.
Okay,
TRN.
there's a missing part here يا ارميا. في missing part. في حاجه في الاوفر يعني. لا خلينا راجع. انا راجع امتى تراجع السيجما. هي برضو انت كلامك صح by the way. It's correct. But here number one you are talking about the annual you are talking about the long term or chronic use. Okay, this is number one. Number two, we are not making a recommendation here to the physician. We are talking about the urgent condition or situation that you have to handle. If you have the Ventolin in stock and you have Flovent, you cannot assume that Symbicort will be better for 1 week or 2 weeks or something. You should dispense the Ventolin and Flovent and recommend the patient to see his doctor. Okay?
تمام.
Okay, this is number one. Number two, regarding the Sigma trial, yes, Symbicort turned out to be more effective in comparison to Flovent. Okay, in terms of the annual exacerbations, but in comparison to the corticosteroid, I cannot remember what was the other one. I think I have here the study. Just one moment, my friend. I have it here. استنى افتحها لك عشان بس نخلص الموضوع ده.
معلش انا بعتذر اذا كنت، بس انا امبارح عامل القصه دي يعني عشان بس يعني هي جت معايا بالصدفه بصراحه.
It's very important, my friend.
لان هو يعني حتى قالوا انه امشي على السيجما 2 nowadays.
Yes, correct. This is right.
That's it.
This is correct.
عشان كده احنا اكيد حضرتك في الصيدليه لما من 4 شهور راحوا سحبوا الفنتولين كله وبعد كده رجعوه حاليا. بس
Excuse me, can you speak in English? Thank you.
Okay. I am so sorry. I am so sorry. I will speak in English.
Thank you.
Okay. I will repeat which I am said. That is nowadays what I know. That is we are do Sigma 2 trials, which said that I can use the Symbicort, which is a cortisone plus formoterol for a rescue medication over the Ventolin plus the Flovent. I can use this or that, but the most recent evidence that I use the Symbicort over the Ventolin plus ICS. That's it. And nowadays in our pharmacy, we follow the new guidelines, which are Sigma 2. That's it. Assume that I have pause in my pharmacy. It is not in this case. I asked the doctor if I have pause in my pharmacy, but in this case I haven't. The Ventolin, it is a pack order, so I am forced.
Here it is, my friend. Here it is. This is the conclusion. Excuse me, sorry, it's in French.
It's okay.
But
it's
yes,
okay.
I can tell you the conclusion that Symbicort, okay, is not inferior to the treatment with what is it? The budesonide.
La combination.
Yeah, budesonide is which inhaler? That it's Rhinocort. It's not Rhinocort. Pulmicort, excuse me. Yes. So then the Symbicort is not inferior to Pulmicort. Pulmicort contains only corticosteroid for the prevention of a severe exacerbation of asthma. But the Pulmicort twice daily remains the best or the better option for the treatment of asthma. That's it. Okay, so the better treatment is the corticosteroid. That's what I was trying to say. Corticosteroid is better than the Symbicort. You can recommend Symbicort if the patient, here what we do in Quebec, if the patient is not taking regularly his corticosteroid medication, here's a chance to give him the Symbicort as a reliever and at the same time as the controller. You can tell him, just take the Symbicort, it will act as both. You can take it when needed, if you have any sensation or something, but it's recommended to take it twice daily. If you cannot, so you can take it when needed. For the patients who's forgetting most of the time to take the Fluent, for example. But the best solution remains the Fluent. Okay?
Okay.
You got my point?
Yes, I get it. Thank you, sir.
C'est bien compris, mon ami?
Okay.
Okay.
وبينسوق
clear, huh?
وبينسوق على طول
Okay,
وبينسوق.
so it's clear, my friends?
So, doctor, just one more thing.
Yes.
The patient can take it as twice a day, the high dose, and let's say in between he has asthma attack, then he can take it as needed as well.
Repeat that. I'm sorry. Just repeat.
Right, the station we have, we recommend to take it high dose twice a day, right? Let's say he took it morning and the other dose will be evening. But afternoon he has asthma, like he has shortness of breath and he has asthma condition. Can he take it again?
Yeah, he can take it as a reliever as well.
Okay.
Okay.
Yeah,
up to
thanks.
8 puffs for the 20 milligrams. Okay, so we are done, my friends. Any questions, any comments, any something you would like to add? Gazuli, do you like to comment?
لا أنا تمام. Nessa, do you have further station or we're done for today? نور, we are done for today.
حلو كده نور.
معقول كده.
Okay. Thank you so much.
ماشي يا شباب. I hope إن هي كانت ستيشن ظريفة يعني. كان فيها جدل كتير but it should be benefit يعني. ماشي.
So we will have access to this, right? To like you said, we have to. It will be there like a question bank or access to this